Do you ever wince when you climb a flight of stairs, feeling that sharp twinge in your knee that makes you grip the railing just a little tighter? Or maybe it's when you bend down to pick up something off the floor, or even worse, when you try to stand up from your favorite chair after a long day, and your legs just don't cooperate without protesting. If that sounds familiar, take a deep breath. Because you're far from alone in this struggle. Millions of people deal with knee pain every single day, whether it's from osteoarthritis wearing down the joints over time, an old sports injury that never quite healed right, or just the buildup of years spent on your feet, without giving your body the care it deserves. But here's the good news that might just change everything for you. This doesn't have to be your forever. You don't have to resign yourself to a life of limitations, popping pills, or avoiding the activities you love. There's a smarter, more effective way to reclaim your mobility, build real strength, and move through your day without that constant fear of pain flaring up. It's not about pushing through with grueling workouts or relying on quick fixes. It's about understanding how your body really works, retraining those muscles to support you properly, and making small, consistent changes that add up to big results. Imagine walking briskly down the street, tackling stairs with ease, or even chasing after grandkids without a second thought. That's not a distant dream, it's achievable, and it starts right here with some practical, science-supported strategies that anyone can try, no matter your age or fitness level. Stick with me, and by the end of this, you'll have the tools to start feeling stronger and more confident in your knees today. Let's dive deeper into why knee pain happens in the first place, because knowledge is your first step toward freedom from it. Often, it's not the knee joint itself that's the root culprit, it's the way everything around it is functioning, or rather, malfunctioning. Think of your knee as the middle child in a family of muscles and joints. It relies on the hips above and the ankles below to share the load. When those areas get stiff or weak, the knee ends up taking the brunt of every step, every bend, every twist. Add in years of bad habits, like slouching at your desk, walking with your feet turned out, or sitting for hours on end, and you create imbalances where some muscles overwork while others slack off. For instance, tight hamstrings at the back of your thigh can pull everything out of alignment, forcing your knee to compensate and leading to that nagging ache. Or weak glutes, those powerhouse muscles in your backside, might not stabilize your hips properly, causing your knee to wobble inward during movement, which irritates the tendons and cartilage over time. And let's not forget about inflammation from old injuries or the natural wear of osteoarthritis, where the cushioning in your joint thins out, making every motion feel like grinding gears. But here's where it gets exciting. Science shows us that by focusing on retraining these muscles, improving mobility in your hips and ankles, and learning to distribute weight evenly across your entire leg, you can turn this around. It's like recalibrating a machine that's been running off kilter for too long. Simple daily practices, such as gentle stretches to loosen up those tight spots, can release built-up tension and allow your knee to move more fluidly. Pair that with targeted strengthening, and you're not just masking the pain, you're addressing the cause. Plus, incorporating smart recovery tricks, like using cold packs after activity to soothe swelling or warm compresses at rest to relax stiff muscles, helps your body heal faster. The key is listening to what your body is telling you. If something feels off, adjust rather than ignore it. With patience and consistency, these adjustments can reduce inflammation, rebuild stability, and help you regain that effortless movement you've been missing. And the best part, you don't need fancy equipment or hours at the gym. Just a few minutes a day dedicated to your well-being. Now, to make this real and actionable, let's talk about 2 powerhouse exercises that can transform how your knees feel and function. These aren't complicated routines that require athletic prowess. They're straightforward, safe moves designed for everyday people like you and me, backed by research showing they strengthen without straining. We'll start with the isometric lunge, a game changer for anyone who's ever felt that knee pain creep in during simple activities. Picture this: you're in the middle of a walk, and suddenly your knee buckles a bit, sending a jolt of discomfort that makes you second-guess every step. That's often due to poor technique in how we move, not just in workouts but in daily life. The isometric lunge teaches your body better patterns, focusing on holding a position rather than bouncing up and down, which minimizes impact on the joint. To do it right, step 1 foot forward into a lunge stance, like you're pausing mid-stride in a confident walk. Keep your front knee bent at about 90 degrees, with your back knee hovering just above the ground if you can, but don't force it. Comfort is key here. Your chest stays tall, like you're proudly showing off good posture, and engage your core by gently pulling your belly button toward your spine. This isn't about dropping low or pushing hard, it's about balance. Hold that position for 10 to 20 seconds, feeling the muscles in your thighs, glutes, and even your core fire up together. Make sure your weight is centered over your feet, not too far back on your heels, which shifts everything to your backside, or too forward on your toes, which stresses the front of your knee. Studies from physical therapy experts highlight how this balanced hold reduces stress on the patella, that small bone at the front of your knee, and helps prevent common issues like tendon inflammation or cartilage wear. It's like training your muscles to be a supportive team, where no one player, the knee, has to carry the whole game. If you're new to this or feeling a bit unsteady, grab onto something stable like a chair, wall, or even a sturdy doorframe for support. This takes the pressure off while you build confidence, allowing your muscles to learn without overwhelming the joint. As you get stronger, you can hold longer or add a light weight, like a water bottle in each hand, but always progress slowly. Rushing leads to setbacks. What makes this exercise so powerful is its focus on neuromuscular training, a fancy term for teaching your brain and muscles to communicate better. Research in rehabilitation journals explains that after injuries or with age, our bodies lose some of that coordination, leading to wobbly movements and pain. The isometric lunge rebuilds it, activating not just the quadriceps in the front of your thigh, but also the hamstrings and glutes, creating a protective shield around your knee. Imagine your leg as a well-oiled chain. When every link works smoothly, the whole system glides without friction. Complement this with a quick hamstring stretch afterward. Sit on the floor with one leg extended, lean forward gently from your hips, and hold for 20 seconds per side. This releases any tightness that's been pulling on your knee, enhancing the benefits. People who've dealt with chronic pain for years often report feeling more stable after just a few weeks, climbing stairs without that familiar dread or bending down without hesitation. It's not magic, it's your body responding to intelligent, low-impact training that prioritizes protection over punishment. Moving on to our second exercise, the wall sit, which might sound basic but packs a serious punch for knee health. This one is perfect if you've ever felt your knees give way when squatting down, or if osteoarthritis makes dynamic movements feel risky. Unlike regular squats that involve up and down motion, which can aggravate sensitive joints, the wall sit is all about stillness and control, holding your muscles under tension without moving the knee much at all. Lean your back against a wall, feet shoulder-width apart, and slide down until your thighs are parallel to the ground. Like you're sitting in an invisible chair. Your knees should stack right over your ankles, not pushing forward past your toes, which would overload the front of the joint. Distribute your weight evenly through the middle of your feet, and hold for 20 seconds to start, breathing steadily. Feel that burn in your quads. That's them waking up and getting stronger, along with your glutes and hamstrings, all working in harmony to support your knees. Biomechanical research supports this approach, showing that isometric holds like this minimize compression on the patella and tendons, making it safer for those with wear and tear or post-injury weakness. To keep things interesting and tailored to your needs, try variations that amp up the stability benefits. Slip a resistance band around your thighs just above the knees and gently press outward. This fires up the gluteus medius, a often overlooked muscle on the side of your hip that prevents your knees from caving in, a common trigger for pain known as valgus collapse. If you notice your knees knocking together when you walk or stand, this is your fix. Alternatively, squeeze a soft ball or pillow between your knees to engage the inner thigh adductors, balancing out the forces around the joint. These tweaks, drawn from studies on knee rehabilitation, improve proprioception, your body's sense of where it is in space, reducing the risk of stumbles and chronic discomfort. Even if you're older or recovering from surgery, the wall sit is adaptable. Start higher up the wall if a full 90-degree bend feels too intense, and build from there. It's like giving your knees a daily tune-up, strengthening the entire lower body chain while keeping your spine aligned and core engaged, which bonus helps ward off back pain too. Why does this matter for everyday life? Because activities like getting out of a car, picking up groceries, or navigating uneven sidewalks demand this kind of enduring strength, not just explosive power. Research from experts in sports medicine, like a 2008 study on isometric training, reveals it boosts eccentric control, the muscle's ability to brake and stabilize during descents, such as going downstairs, cutting injury risks dramatically. But here's a crucial piece that's often overlooked, even by seasoned folks trying to manage knee issues: the importance of achieving full knee extension. You might think flexibility is all about bending deeper, but straightening your knee completely, without forcing it into a hyperextended lock, is equally vital. If your knee stays slightly bent all the time, your quadriceps can't fire at full capacity, leaving the joint vulnerable to overload. It's like driving a car with the parking brake partially engaged. Everything works harder than it should, leading to faster wear. Tight hamstrings or calves are frequent culprits, tugging the knee out of alignment and causing that semiflexed walk that grinds on the cartilage. To counter this, incorporate daily stretches for hamstrings. Lie on your back, loop a towel around one foot, and gently pull the leg up while keeping it straight, holding for 30 seconds. For calf, stand facing a wall, 1 foot back, and lean in to stretch the back leg. Studies from 2015 on knee kinematics confirm that easing this tightness improves movement patterns, reduces pressure on the front of the knee, and enhances overall stability. Pair it with active extensions. Sitting on a chair, slowly straighten one leg out in front, hold for a few seconds, and lower. This rebuilds that brain-muscle connection, often disrupted after injuries through what's called arthrogenic inhibition. The result? Better shock absorption during walks, less pain when standing for long periods, and a more natural gait that feels effortless. Of course, no plan is complete without smart recovery to let your efforts pay off. After these exercises, if your knees feel warm or swollen, apply a cold pack wrapped in a cloth for 10-15 minutes. It calms inflammation without numbing you out. At rest, especially if muscles feel tight, use a heating pad to boost blood flow and relaxation. But recovery isn't just passive. Gentle activities like a slow stroll around the block or easy cycling on a stationary bike promote synovial fluid production, that natural lubricant keeping your joints smooth and nourished. A 2015 study on osteoarthritis patients found light movement more effective than total rest for pain relief and function. Remember the golden rule of progressive overload: increase challenge gradually, with rest days built in. If sharp pain hits, not the good muscle fatigue, but something that worsens with motion, pause, reassess your form, and ease back. Your body adapts during downtime, turning those small efforts into lasting strength. Putting it all together, these strategies aren't fleeting hacks. They're rooted in biomechanics and neuroscience, designed to work for real people facing real challenges. By activating a full team of muscles, quads, glutes, hamstrings, and more, you distribute loads evenly, avoiding that pinpoint stress on the knee. Controlled low-impact moves sidestep irritation to cartilage and bursae, while boosting proprioception helps you navigate life with surer footing. Whether you're an athlete eyeing a comeback, or someone just wanting to garden without agony, dedicating 10-15 minutes daily can restore mobility and joy. Stay consistent, tune into your body, and train wisely, not wildly. If this resonates, like and share to help others. Subscribe for more science-backed tips and start today. Your knees are ready to thank you with every painless step. Disclaimer: Grok is not a doctor, please consult one. Don't share information that can identify you.